After Jaxon got home, there were some odd things we were noticing.
First sign of trouble was he started headbutting, and that was probably around 9, 10 months. At about the 1 year point, he started biting his gums and his lips.
He's biting his tongue, he's bleeding. Something wasn't right. So Jaxon had to see a lot of specialists, and every time we brought up a concern, they said, you know, he was such a micro-preemie, just give him time.
Then about this 18-month range, he started scratching really bad, to the point that it would bleed. So one night I walked into his room, looked into his crib, and there he is with a white t-shirt on. It's covered with blood. I'm scared to death. I pick him up, make sure he's alive. It looked like he had been stabbed. He was scratching himself.
So at 2.5 years old,
Julie got a call from a high school friend who knew Tony Dungy from his days in the NFL and knew that Tony had a son with a rare pain disorder.
Tony said, Julie, quit doctor shopping. You need to go to Johns Hopkins in Baltimore. And we have a neurologist there, and I'm gonna make a phone call for you.
Jaxon was diagnosed with HSAN, which stands for Hereditary Sensory Autonomic Neuropathy.
Jaxon does not have a peripheral nervous system. Jaxon will never feel pain. You won't feel it if you slam your hand in their car door. You won't feel when you get stung by a bee. We found out that this condition is the rarest upon rare. This was going to be quite the journey a lot of people didn't know anything about.
Jaxon first broke his femur at age 7, and then after that, it was just seemed like one break after the other. He would break his radius, his ulna, his tibia, his fibia. It was terrible.
We were mentally exhausted, we were physically exhausted. There was lots of fighting.
Those times were very hard because we're trying to figure this thing out and we don't have all the answers.
I know he can be paralyzed from breaking his spine. I know he can possibly never walk again if he were to do something he didn't feel. You're raising a different child.
We didn't know what the future looked like.
Well, it's good to meet you both, and we're going to meet Jaxon today. And at the point that you were rushed to the hospital, you knew it was way early, so you knew that this was a high-risk pregnancy and was going to be very likely a high-risk delivery, right?
That is exactly right.
And what was your greatest fear at that point?
I think my biggest fear was I had been in so much pain for about 3 weeks. Honestly, when they took me there, it was a weird feeling. I almost kind of thought, I know that he's gone because there's just no way. There's just been too much pain. This is not normal. This is just not normal.
You know, something was wrong.
Right.
Yeah. What was your position in this? Because from a dad standpoint, a husband standpoint, there's kind of a helpless feeling, right?
Yeah, there's just the unknown. Are we probably going to lose him?
Right. And when you went through the process of, you said, giving him a death name.
Yes.
Take me through the process. What conversation did you guys have between yourselves in going through that process and facing that reality?
The doctors are saying if this baby is born at 25.5 weeks or 25 weeks or 24 weeks, his chances of survival are about 10%. And y'all need to start preparing for that. They gave you the worst case scenario. I had this overwhelming, this child is going to make it.
What did you think was happening when you saw your son scratch himself and bite through his lip and his tongue?
It had initially started with headbutting, and
Right.
we just thought, well, okay, that's just what babies do.
We didn't know. We were first-time parents. We have no idea.
Do you have a story or a question for me? Click the link in the description and tell me what in the world is going on.